And a good morning to you. The time now 9:43. I'm Christopher Sine. We are interrupting your programming for an update to breaking news we've been following all morning involving a hazmat situation, a scare in Ahwatukee involving a man who recently returned from West Africa. A news conference now underway at Maricopa Medical Center involving that treatment. Let's listen.
Well, I'll start off by telling you I'm sorry there's limited clinical information that I can give you, but I will tell you that early this morning we had a recently returned traveler to the United States who was under the standard precautions and observation techniques that public health is performing, who developed some symptoms, who was brought in by the fire department and began evaluation in the emergency department. This patient's symptoms and presentation aren't strongly suggestive of Ebola disease, and I think that Dr. Sunshine will talk to you about his risk, but we would consider him to be at very low risk of Ebola. His evaluation is ongoing, and in fact, given his presentation, I would be not surprised if he actually was discharged back home following his initial evaluation. We've been preparing for these kinds of encounters with patients who had traveled for quite some time. This was an opportunity to exercise our complete process out of abundance of caution. We did follow our normal process for this type of a disorder, so we did close off a section of our emergency department for a period of time. We will be reopening the emergency department, and we are certainly open for all the rest of the care that we provide within the facility. We solely were closing down that area of the emergency department in which this patient was housed until we sorted out what's going on with him. And I think I'll ask Dr. Sonnensheim to give us some additional information from the public health standpoint.
Hi, thank you, Dr. Frum. We are currently working together with Maricopa Integrated Health System and Phoenix Fire and all of our partners to make sure that we are following all of the protocols that we have been planning for the last several weeks to months. We have been monitoring this individual since he returned from West Africa. Per protocol, when he developed symptoms, public health was contacted first. They worked directly with Phoenix Fire as well as Maricopa Integrated Health System, so that this has been a very coordinated, collaborative, and controlled transport to the emergency department. This individual did not come into contact with anyone with Ebola in West Africa. This person has not treated any patients, did not attend any funeral services. Therefore, this person is at a very low risk for having Ebola. As Dr. Frum mentioned, the symptoms are also not consistent with Ebola, but because the individual did travel to West Africa in the prior 21 days, we are acting out of an abundance of caution. It's important to note that he developed his symptoms after he arrived home. So the passengers on the flight are at no risk of contracting anything from this individual. Again, he developed symptoms after he returned home. Additionally, this individual did arrive home recently and has not had contact with any neighbors. The neighbors can rest assured that they are at no risk, and we would ask the media to please let the neighbors enjoy their holiday in peace. They really do not have any information at this point. Lastly, I just want to emphasize that this has been very coordinated with all of our partners, and we have been practicing this for some time, and everything is going as it is supposed to, making sure that healthcare workers and the public are protected. And with that, I will take any additional questions.
Yes, you said that this patient did not treat any patients, so is this patient a member of the medical community then?
This individual was not in contact with any patients while he was over in West Africa.
So, but this person is not necessarily a member of the medical community then?
This individual was over there as part of the Ebola response, but did not treat any patients.
Are you doing a blood test on this? Is it being sent to the state labs? And when would that be coming?
Because this individual has traveled and is being evaluated in a medical setting, out of an abundance of caution, we are doing an Ebola test. We're not going to be able to share any test results because that would not be okay with patient confidentiality. However, we are running a test and it is in progress.
How long does it take to get the results back?
We will likely get the test results back within the same day.
When you talk about symptoms and you guys say it's not a strong candidate, what are the symptoms that make someone a strong candidate, and what symptoms is he not showing that make it different here?
We can't speak specifically about the symptoms of this patient, but in general, when somebody is at risk for Ebola, they're having a fever greater than 100.4, and then other symptoms with that. And this particular patient is not demonstrating symptoms that are consistent with Ebola.
So is the lack of a fever or the lack of that sign a sort of an indicator that it's not going to happen, or could the fever possibly come later? Is the fever the first thing, I guess is my question?
So the normal presentation for this illness is the development of fever, and actually a relatively higher fever. This patient didn't, we can't really talk about these kinds of things, but his presentation is not consistent with Ebola. From a clinical standpoint, it's much more consistent with some other disorders, and we'll be testing and treating the patient as necessary.
Curious, in terms of the hospital and public health, how much contact have you guys had throughout this whole process with the CDC and how you're supposed to respond and sort of the organization of it all?
So our normal protocol is the individual was under monitoring by local public health. This individual did contact local public health, who then contacted state public health and CDC. CDC does have to approve a test for Ebola to be run, so they are aware of this individual, and they are completely in the loop, as are all of our local and state partners.
Was this patient a doctor? You mentioned that he was in Africa as part of the Ebola response. Was he a medical worker? Can you say whether he was a medical worker?
I can't comment on his specific activities, but I can assure you that this individual was not in direct contact with any Ebola patients.
And you said he was under monitoring by local public health.
Mm-hmm.
Did that commence immediately upon his return because of where he had been?
Per our local public health protocol, we contact any individual who has traveled to one of those areas within 24 hours of their arrival, and that did occur.
So you know how long he had been under monitoring and what type, did he self-report these symptoms to you?
This individual did self-report the symptoms to public health.
And did you initiate the contact with him after he returned, or did he initiate the contact with you?
Because these symptoms developed relatively soon after he arrived, he initiated contact with public health.
I mean, normally it's temperature, right? That's what the people under monitoring take, but he wasn't up to 100.4.
I can't comment specifically on his symptoms, but the returning travelers are instructed to contact public health if they develop any symptoms that are concerning to them at all before they go and seek health care. So we can't comment again on the specific symptoms, but it is not just fever that would spark him to call public health.
The Secretary of Homeland Security had announced that anyone traveling from West African countries that are affected by Ebola go through the screenings at one of those 5 designated airports in the U.S. Do we know, did he travel directly to one of those airports and undergo the health screenings prior to arriving in Phoenix?
Absolutely. He did travel through one of the 5 airports. He was appropriately screened by Customs and Border and CDC, and we were notified that he was going to return here before he actually did return here. So all of the public health processes in place worked, and we're successful, and that is why we're able to have a nice controlled response.
And I would just to echo that, there was good coordination between public health, the fire department, the MIHS personnel that were involved as well to lead to a very coordinated process.
How long has he been back in the States?
This individual just arrived back in the States within the last 24 hours.
He's being treated here at the hospital, as you know, in Dallas. Some of the hospital workers contracted Ebola. What does the hospital do in a situation like this? How do you guys operate in terms of keeping people safe if there is an Ebola case?
So as probably everyone who's listening to this newscast is aware,
Okay, you're getting an update right now on that man who is now being treated at Maricopa Medical Center. We are told his symptoms included diarrhea and vomiting and a slight fever, but you just heard right there that they do not believe that he has Ebola, certainly calling it a low-risk situation. However, confirming that the CDC and federal authorities are well aware of what is taking place here in the Valley at this very hour. Also noteworthy here, there is no risk to passengers who are on the plane with this gentleman, and also no risk to his neighbors in the Ahwatukee area, where all of this started to unfold around 2:30 this morning, living in the area of 40th Street and Chandler Boulevard. We will continue our live team coverage as this situation continues to develop, because as they confirmed right there, an Ebola test is underway on this individual, just to be sure that everything is safe and clear. But right now they're calling this a low-risk situation. We have in-depth details right now on ABC15.com, and our team coverage continues on ABC 15 News at 5. We now return to regular programming.